Welcome back to Road to Nursing License. Today's NCLEX practice is focused on acute kidney injury, AKI, a high-yield topic you'll definitely want to master before exam day. These questions cover the causes of AKI, risk factors, assessment findings, laboratory values, fluid and electrolyte imbalances, nursing interventions, medications, dialysis, patient teaching, and priority nursing care. After each question, I'll explain the correct answer, why the other options are incorrect, and share a practical strategy to help you answer similar NCLEX questions with confidence. If you're ready to strengthen your clinical judgment and move one step closer to your nursing license, let's get started. Question 1. A nurse is caring for a client at risk for acute kidney injury, AKI. Which assessment finding should the nurse recognize as the earliest indication of AKI? A. Generalized edema. B. Decreased urine output. C. Hypertension. D. Crackles in the lungs. Correct answer, B. Decreased urine output. Rationale. Oliguria, urine output less than 400 milliliters per day in adults, is often the earliest clinical sign of AKI. As kidney function declines, urine production decreases before many other symptoms become apparent. Strategy. When answering AKI questions, always monitor urine output first. It is one of the earliest and most important indicators of kidney function. Question 2. A client with AKI has a serum potassium level of 6.5 milliequivalent/L. Which nursing action is the priority? A. Encourage foods rich in potassium. B. Place the client on continuous cardiac monitoring. C. Increase oral fluid intake. D. Restrict protein intake. Correct answer, B. Place the client on continuous cardiac monitoring. Rationale. Hyperkalemia is a life-threatening complication of AKI because it can cause fatal cardiac dysrhythmias. Continuous cardiac monitoring allows early detection of dangerous rhythm changes while treatment is initiated. Strategy. On the NCLEX, elevated potassium always makes you think protect the heart first. Question 3. Which laboratory value best reflects kidney function in a client with AKI? A. Hemoglobin. B. Serum creatinine. C. Platelet count. D. Albumin. Correct answer, B. Serum creatinine. Rationale. Serum creatinine increases as kidney filtration declines. It is one of the most reliable indicators of renal function. Strategy. Remember, creatinine tells you how well the kidneys. Question 4. Which client is at the greatest risk for developing acute kidney injury? A. A healthy 22-year-old with seasonal allergies. B. A 70-year-old receiving nephrotoxic antibiotics. C. A teenager with a sprained ankle. D. A client with controlled hypothyroidism. Correct answer, B. A 70-year-old receiving nephrotoxic antibiotics. Rationale. Older adults and clients receiving nephrotoxic medications are at significantly higher risk for AKI because aging kidneys are more vulnerable to injury. Strategy. Look for risk factors such as advanced age, dehydration, sepsis, major surgery, and nephrotoxic drugs. Question 5. A client with AKI is experiencing fluid volume overload. Which assessment finding should the nurse expect? A. Dry mucous membranes. B. Weight loss. C. Crackles on lung auscultation. D. Sunken eyes. Correct answer, C. Crackles on lung auscultation. Rationale. Fluid overload commonly causes pulmonary congestion, resulting in crackles, dyspnea, and peripheral edema. Strategy. Excess fluid usually affects the lungs first. Listen for crackles. Question 6. Which electrolyte imbalance is most commonly associated with acute kidney injury? A. Hypokalemia. B. Hyperkalemia. C. Hypernatremia. D. Hypocalcemia only. Correct answer, B. Hyperkalemia. Rationale. Damaged kidneys cannot adequately excrete potassium, causing potassium levels to rise. Strategy. AKI equals think potassium retention. Question 7. A nurse reviews laboratory results for a client with AKI. Which finding requires immediate follow-up? A. BUN 32 mg per deciliter. B. Creatinine 2.0 mg per deciliter. C. Potassium 6.8 milliequivalent/L. D. Phosphorus 5.2 mg per deciliter. Correct answer, C. Potassium 6.8 milliequivalent/L. Rationale. A potassium level of 6.8 milliequivalent/L places the client at high risk for lethal cardiac dysrhythmias and requires immediate intervention. Strategy. Whenever potassium is critically high, think life-threatening. Question 8. A nurse is teaching a client about medications that may contribute to AKI. Which medication should the nurse include? A. Acetaminophen. B. Ibuprofen. C. Vitamin C. D. Calcium carbonate. Correct answer, B. Ibuprofen. Rationale. NSAIDs such as ibuprofen can reduce renal blood flow and contribute to kidney injury, especially in susceptible individuals. Strategy. NSAIDs are common NCLEX examples of nephrotoxic medications. Question 9. A client with AKI develops metabolic acidosis. Which assessment finding is most likely? A. Slow, shallow respirations. B. Kussmaul respirations. C. Bradycardia. D. Hyperactive bowel sounds. Correct answer, B. Kussmaul respirations. Rationale. The body compensates for metabolic acidosis with deep, rapid respirations to eliminate carbon dioxide. Strategy. Metabolic acidosis equals lungs try to compensate. Question 10. Which nursing intervention helps prevent acute kidney injury after administration of 4-contrast dye? A. Restrict fluids before the procedure. B. Encourage adequate hydration. C. Limit urine output. D. Encourage a high-protein diet. Correct answer, B. Encourage adequate hydration. Rationale. Adequate hydration helps flush contrast dye from the kidneys and reduces the risk of contrast-induced nephropathy. Strategy. Hydration protects the kidneys. Question 11. A client with AKI has gained 2 kilograms in 24 hours. What does this finding most likely indicate? A. Improved nutrition. B. Fluid retention. C. Muscle growth. D. Increased metabolism. Correct answer, B. Fluid retention. Rationale. Rapid weight gain is a reliable indicator of fluid retention in clients with kidney dysfunction. Strategy. Daily weight is the most accurate indicator of fluid balance. Question 12. Which physician prescription should the nurse question for a client with severe AKI? A. Strict intake and output. B. Daily weights. C. Potassium supplement. D. Monitor electrolytes. Correct answer, C. Potassium supplement. Rationale. Clients with AKI commonly retain potassium. Administering potassium supplements could worsen hyperkalemia. Strategy. Never give potassium unless you know the level is safe. Question 13. A client with AKI reports nausea and itching. These symptoms are primarily caused by A. Low blood sugar. B. Uremia. C. Dehydration. D. Infection. Correct answer, B. Uremia. Rationale. Accumulation of waste products due to impaired kidney function causes uremic symptoms, including nausea, pruritus, fatigue, and confusion. Strategy. Think uremia whenever waste products build up. Question 14. Which finding indicates that treatment for hyperkalemia has been effective? A. Potassium decreases from 6.3 to 4.8 milliequivalent/L. B. BUN increases. C. Creatinine increases. D. Urine becomes darker. Correct answer, A. Potassium decreases from 6.3 to 4. 8 milliequivalent/L. Rationale. A potassium level within the normal range indicates successful treatment and reduced risk of cardiac complications. Strategy. Always compare laboratory values with normal ranges. Question 15. Which assessment finding requires immediate intervention in a client with AKI? A. Mild fatigue. B. Loss of appetite. C. Peaked T waves on ECG. D. Dry skin. Correct answer, C. Peaked T waves on ECG. Rationale. Peaked T waves are classic signs of hyperkalemia and may rapidly progress to life-threatening cardiac dysrhythmias. Strategy. ECG changes with hyperkalemia are emergencies. Question 16. Which nursing intervention is appropriate for a client during the oliguric phase of AKI? A. Encourage unlimited oral fluids. B. Monitor intake and output carefully. C. Increase potassium intake. D. Administer nephrotoxic medications. Correct answer, B. Monitor intake and output carefully. Rationale. Accurate fluid monitoring helps prevent both fluid overload and dehydration during the oliguric phase. Strategy. Strict intake and output is a nursing priority in AKI. Question 17. Which assessment finding suggests that a client is entering the diuretic phase of AKI? A. Urine output increases significantly. B. Potassium increases sharply. C. Creatinine immediately returns to normal. D. Blood pressure becomes severely elevated. Correct answer, A. Urine output increases significantly. Rationale. The diuretic phase is characterized by increased urine output, but the kidneys are still unable to concentrate urine effectively. Strategy. More urine does not mean the kidneys have fully recovered. Question 18. Which client statement indicates a need for further teaching? A. I'll avoid taking ibuprofen unless approved. B. I'll stay hydrated when appropriate. C. I'll stop taking my blood pressure medicine without telling my provider. D. I'll keep my follow-up appointments. Correct answer, C. I'll stop taking my blood pressure medicine without telling my provider. Rationale. Clients should never discontinue prescribed medications without consulting their healthcare provider. Strategy. NCLEX often tests safe medication practices through patient teaching. Question 19. Which finding is most consistent with prerenal acute kidney injury? A. Severe dehydration. B. Kidney stone obstruction. C. Glomerulonephritis. D. Acute tubular necrosis. Correct answer, A. Severe dehydration. Rationale. Prerenal AKI results from decreased blood flow to the kidneys. Severe dehydration is one of the most common causes. Strategy. Remember the 3 AKI categories ** prerenal. Before the kidney, poor perfusion. Interrenal, damage within the kidney. Postrenal, obstruction after the kidney. Question 20. A nurse is caring for a client with AKI who becomes increasingly confused and difficult to arouse. Which action should the nurse take first? A. Document the findings. B. Assess the client's airway, breathing, and circulation. C. Encourage oral fluids. D. Allow the client to rest. Correct answer, B. Assess the client's airway, breathing, and circulation. Rationale. A sudden change in level of consciousness may indicate worsening uremia, severe electrolyte imbalance, or another life-threatening complication. The nurse should first assess the client's airway, breathing, and circulation before implementing further interventions. Strategy. When a client's condition suddenly deteriorates, always apply the ABCs first. Stabilize the client before moving on to additional assessments or interventions. Question 21. A client with acute kidney injury is receiving furosemide. Which finding indicates the medication is effective? A. Increased urine output. B. Increased serum creatinine. C. Elevated potassium level. D. Decreased blood pressure below normal. Correct answer, A. Increased urine output. Rationale. Furosemide is a loop diuretic that promotes urine production. An increase in urine output indicates the medication is helping remove excess fluid. Strategy: evaluate diuretics by looking at urine output and signs of improved fluid balance. Question 22. Which assessment finding suggests fluid volume overload in a client with AKI? A. Flat neck veins. B. Hypotension. C. Peripheral edema. D. Dry mucous membranes. Correct answer: C. Peripheral edema. Rationale: impaired kidney function causes sodium and water retention, leading to edema, hypertension, and pulmonary congestion. Strategy: think swelling equals fluid retention. Question 23. The nurse is reviewing laboratory results for a client with AKI. Which value should be reported immediately? A. Sodium 138 milliequivalent/L. B. Potassium 7.0 milliequivalent/L. C. Calcium 9.2 milligrams per deciliter. D. Glucose 102 milligrams per deciliter. Correct answer: B. Potassium 7.0 milliequivalent/L. Rationale: a potassium level of 7.0 milliequivalent/L is critically high and places the client at risk for fatal cardiac dysrhythmias. Strategy: the higher the potassium, the higher the priority. Question 24. Which medication prescription should the nurse question for a client with severe AKI? A. Calcium gluconate. B. Regular insulin with dextrose. C. Magnesium-containing antacid. D. Sodium bicarbonate. Correct answer: C. Magnesium-containing antacid. Rationale: clients with AKI have difficulty excreting magnesium. Magnesium-containing medications can worsen hypermagnesemia. Strategy: avoid medications containing magnesium or potassium unless specifically prescribed. Question 25. A nurse is teaching a client recovering from AKI. Which statement indicates understanding? A. I'll take ibuprofen every day for pain. B. I'll drink fluids as instructed by my healthcare provider. C. I'll stop follow-up appointments once I feel better. D. I'll eat as many bananas as I want. Correct answer: B. I'll drink fluids as instructed by my healthcare provider. Rationale: following individualized fluid recommendations helps prevent dehydration or fluid overload during recovery. Strategy: patient teaching focuses on protecting kidney function after discharge. Question 26. Which complication is the greatest concern in a client with untreated hyperkalemia caused by AKI? A. Constipation. B. Cardiac arrest. C. Joint pain. D. Weight loss. Correct answer: B. Cardiac arrest. Rationale: severe hyperkalemia can cause ventricular dysrhythmias that may progress to cardiac arrest. Strategy: potassium problems are heart problems. Question 27. The nurse expects which acid-base imbalance in a client with AKI? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Metabolic alkalosis. Correct answer: B. Metabolic acidosis. Rationale: the kidneys cannot adequately excrete hydrogen ions or regenerate bicarbonate, resulting in metabolic acidosis. Strategy: damaged kidneys retain acid. Question 28. Which finding indicates that a client with AKI may need dialysis? A. Potassium 7.2 milliequivalent/L despite treatment. B. Blood pressure 128/76 mmHg. C. Urine output 1,500 milliliters per day. D. Sodium 140 milliequivalent/L. Correct answer: A. Potassium 7.2 milliequivalent/L despite treatment. Rationale: persistent severe hyperkalemia that does not respond to medical treatment is a common indication for emergency dialysis. Strategy: remember the AEIOU indications for dialysis. Acidosis, electrolyte imbalance, intoxication, overload, uremia. Question 29. Which nursing intervention is most appropriate for a client in the oliguric phase of AKI? A. Encourage foods high in potassium. B. Monitor daily weights. C. Increase fluid intake without restriction. D. Limit vital sign assessments. Correct answer, B. Monitor daily weights. Rationale. Daily weight is the most accurate indicator of fluid status in clients with kidney injury. Strategy. Daily weight is more reliable than edema alone. Question 30. A client with AKI has elevated BUN and creatinine levels. These findings indicate A. Improved kidney function. B. Reduced kidney filtration. C. Liver failure. D. Increased red blood cell production. Correct answer, B. Reduced kidney filtration. Rationale. Elevated BUN and creatinine indicate that the kidneys are unable to effectively filter nitrogenous waste products. Strategy. High BUN and creatinine usually point to decreased kidney function. Question 31. Which client is most likely to develop postrenal AKI? A. A client with severe burns. B. A client with an enlarged prostate causing urinary obstruction. C. A client with septic shock. D. A client with dehydration. Correct answer, B. A client with an enlarged prostate causing urinary obstruction. Rationale. Postrenal AKI occurs when urine flow is obstructed, causing pressure to build up within the kidneys. Strategy. Think postrenal equals obstruction. Question 32. A client with AKI suddenly develops shortness of breath and crackles throughout both lungs. What is the nurse's priority action? A. Encourage ambulation. B. Place the client in high Fowler's position. C. Offer oral fluids. D. Restrict oxygen therapy. Correct answer, B. Place the client in high Fowler's position. Rationale. High Fowler's position promotes lung expansion and improves breathing while additional interventions are arranged. Strategy. When breathing is affected, prioritize airway and oxygenation. Question 33. Which ECG change is most commonly associated with hyperkalemia? A. Peaked T waves. B. ST segment elevation. C. Atrial flutter. D. Prolonged QT interval. Correct answer, A. Peaked T waves. Rationale. Peaked T waves are one of the earliest ECG changes seen with hyperkalemia. Strategy. Peaked T waves should immediately make you think of elevated potassium. Question 34. Which finding suggests improvement in a client recovering from AKI? A. Creatinine continues to rise. B. Urine output gradually returns to normal. C. Potassium remains elevated. D. Increasing generalized edema. Correct answer, B. Urine output gradually returns to normal. Rationale. Improving urine output is a positive sign of recovering kidney function. Strategy. Improving kidney function usually means improving urine production. Question 35. The nurse is caring for a client with AKI who is confused and restless. These findings are most likely related to A. Uremia. B. Hyperthyroidism. C. Hypoglycemia. D. Iron deficiency. Correct answer, A. Uremia. Rationale. Accumulation of nitrogenous waste products can affect the central nervous system, causing confusion, restlessness, and decreased alertness. Strategy. Think about toxin buildup whenever neurological symptoms appear in kidney failure. Question 36. Which intervention helps reduce the risk of infection in a client receiving hemodialysis? A. Assess the vascular access site for redness and drainage. B. Apply a blood pressure cuff to the access arm. C. Draw blood specimens from the dialysis access. D. Encourage sleeping on the access arm. Correct answer, A. Assess the vascular access site for redness and drainage. Rationale. Frequent assessment of the vascular access helps detect infection early and protects the dialysis access. Strategy: protect the dialysis access at all times. Question 37. Which dietary choice is most appropriate for a client with AKI who requires potassium restriction? A. Banana smoothie. B. Baked potato. C. White rice and grilled chicken. D. Orange juice. Correct answer: C. White rice and grilled chicken. Rationale: white rice and grilled chicken are lower in potassium than bananas, potatoes, and orange juice. Strategy: avoid foods known to be high in potassium. Question 38. Which laboratory finding is expected in AKI? A. Elevated serum creatinine. B. Low BUN. C. Decreased potassium. D. Increased hemoglobin. Correct answer: A. Elevated serum creatinine. Rationale: as kidney function declines, serum creatinine rises because it is no longer effectively filtered. Strategy: creatinine is one of the best indicators of kidney function. Question 39. A nurse is caring for a client with AKI receiving calcium gluconate. What is the primary purpose of this medication? A. Remove potassium from the body. B. Protect the heart from the effects of hyperkalemia. C. Increase urine output. D. Lower serum sodium. Correct answer: B. Protect the heart from the effects of hyperkalemia. Rationale: calcium gluconate stabilizes the cardiac cell membrane, reducing the risk of life-threatening dysrhythmias. It does not lower the potassium level. Strategy: remember, calcium protects the heart, it doesn't remove potassium. Question 40. A client with AKI asks why daily blood tests are necessary. Which response by the nurse is most appropriate? A. They help monitor how well your kidneys are recovering and detect complications early. B. They're required for every hospitalized client. C. They're only used to check your blood sugar. D. They aren't really necessary once you're feeling better. Correct answer: A. They help monitor how well your kidneys are recovering and detect complications early. Rationale: frequent laboratory monitoring allows the healthcare team to assess kidney function, electrolyte levels, acid-base balance, and the effectiveness of treatment. Strategy: for AKI, trend laboratory values over time. Changes in creatinine, BUN, potassium, and other electrolytes provide critical information about the client's progress. Question 41. A nurse is monitoring a client with acute kidney injury. Which finding indicates worsening kidney function? A. Serum creatinine increasing from 1.2 mg per deciliter to 3.4 mg per deciliter. B. Urine output of 60 milliliters per hour. C. Blood pressure 122/74 mmHg. D. Heart rate 78 beats/min. Correct answer: A. Serum creatinine increasing from 1.2 mg per deciliter to 3.4 mg per deciliter. Rationale: a rising serum creatinine level indicates that the kidneys are losing their ability to filter waste products effectively, suggesting worsening AKI. Strategy: trend laboratory values instead of looking at one value alone. A rising creatinine is a key sign of declining kidney function. Question 42. A client with AKI is prescribed sodium polystyrene sulfonate. The nurse understands this medication is given to A. Increase urine production. B. Lower serum potassium levels. C. Prevent infection. D. Reduce serum creatinine. Correct answer: B. Lower serum potassium levels. Rationale: sodium polystyrene sulfonate removes excess potassium from the body through the gastrointestinal tract, helping treat hyperkalemia. Strategy: know the common medications used to manage hyperkalemia and their purpose. Question 43. The nurse should immediately report which assessment finding in a client with AKI? A. Mild fatigue. B. Poor appetite. C. New irregular heart rhythm. D. Dry skin. Correct answer: C. New irregular heart rhythm. Rationale: an irregular heart rhythm may indicate severe hyperkalemia, which can quickly become life-threatening if not treated promptly. Strategy: changes in cardiac rhythm always take priority in clients with electrolyte abnormalities. Question 44. Which nursing intervention is most appropriate for preventing additional kidney injury? A. Administer nephrotoxic medications as prescribed without question. B. Monitor intake and output accurately. C. Encourage foods high in potassium. D. Restrict all fluids regardless of provider orders. Correct answer: B. Monitor intake and output accurately. Rationale: careful monitoring of fluid balance helps evaluate kidney function and guides treatment, reducing the risk of kidney damage. Strategy: accurate intake and output records are essential in clients with AKI. Question 45. A client with AKI has a blood urea nitrogen (BUN) level of 68 mg per deciliter. The nurse recognizes this finding indicates A. Improved kidney function. B. Accumulation of nitrogenous waste. C. Liver disease. D. Low protein intake. Correct answer: B. Accumulation of nitrogenous waste. Rationale: an elevated BUN reflects decreased kidney filtration, causing waste products to accumulate in the bloodstream. Strategy: remember that both BUN and creatinine generally rise as kidney function declines. Question 46. Which nursing action is appropriate when caring for a client with an arteriovenous (AV) fistula for hemodialysis? A. Measure blood pressure on the access arm. B. Assess for a thrill and bruit regularly. C. Draw blood samples from the fistula. D. Apply tight dressings over the access site. Correct answer: B. Assess for a thrill and bruit regularly. Rationale: a palpable thrill and an audible bruit indicate that the AV fistula is functioning properly. Blood pressure measurements, blood draws, and fore insertions should be avoided in the access arm. Strategy: protect the dialysis access, it is the client's lifeline. Question 47. Which assessment finding is expected during the recovery phase of acute kidney injury? A. Persistent anuria. B. Gradual decrease in serum creatinine. C. Increasing potassium levels. D. Progressive pulmonary edema. Correct answer: B. Gradual decrease in serum creatinine. Rationale: as kidney function improves, serum creatinine and BUN gradually decrease toward normal, and urine output stabilizes. Strategy: recovery is reflected by improving laboratory values and urine output over time. Question 48. The nurse is caring for a client with AKI who develops confusion, nausea, and a metallic taste in the mouth. These findings are most consistent with A. Hypoglycemia. B. Uremia. C. Hyperthyroidism. D. Iron deficiency anemia. Correct answer: B. Uremia. Rationale: uremia results from the accumulation of waste products in the blood due to impaired kidney function and can cause gastrointestinal and neurological symptoms. Strategy: think uremia whenever AKI presents with confusion, nausea, fatigue, or changes in mental status. Question 49. A client with AKI asks why daily weights are necessary. Which response by the nurse is best? A. They help determine changes in your fluid balance. B. They're only required before dialysis. C. They're used to monitor muscle growth. D. They're mainly for hospital records. Correct answer: A. They help determine changes in your fluid balance. Rationale: daily weight is the most accurate non-invasive method for monitoring fluid gain or loss in clients with kidney disease. Strategy: remember, 1 kilogram 2.2 pounds of weight change is approximately equal to 1 liter of fluid. Question 50. A nurse is caring for a client with acute kidney injury. Which assessment finding requires the highest priority intervention? A. Poor appetite. B. Blood pressure of 148/86 mmHg. C. Serum potassium of 7.1 milliequivalent/L with peaked T waves. D. Fatigue after walking. Correct answer, C. Serum potassium of 7.1 milliequivalent/L with peaked T waves. Rationale. Severe hyperkalemia accompanied by ECG changes is a medical emergency because it can rapidly lead to fatal cardiac dysrhythmias and cardiac arrest. Immediate treatment is essential. Strategy. When prioritizing AKI questions, remember the biggest threats to life are hyperkalemia, pulmonary edema, severe metabolic acidosis, and uremic complications. Use the ABCs and address life-threatening electrolyte abnormalities first.